Hello, my name is Mohamed Hashim. I'm a recently graduated student from University of Medical Science and Technology. I have a quick presentation about the prevalence and outcome of cerebral malaria with adult diagnosis with Plasmodium falciparum at Jubilee National Hospital, Dar es Salaam. As an introduction, cerebral malaria is a severe neurological complication of Plasmodium falciparum infection and remain a major cause of hospitalization, neurological morbidity, and mortality in malaria endemic regions. It's a major cause of neurological coma and death. As an objective, it is to determine the frequency and clinical outcome of cerebral malaria among the patients diagnosed with Plasmodium falciparum at the Muhimbili National Hospital. For the method, facility-based cross-sectional study was conducted from the research department in Muhimbili National Hospital. Data were retrospectively extracted from the medical reports using a standardizing tools. Variables were the signs, symptoms, complications, ICU requirement, treatments, and outcome. Data were analyzed using SPSS version 21 descriptive statistical summarized patient characterized with inferential analysis, including chi-square test, ANOVA, correlations, and logistic regression were used to assess factors associated with cerebral malaria and its outcome. Statistical significance was set as a p-value is less than 0.05. As a result, the prevalence of cerebral malaria were 47% of 113 patients, while non-cerebral malaria in falciparums diagnosed were 53%. As a result, the full recovery was acquired in 55% of the patients, while partial recovery with complications was only 41% and deaths with 4%. As a conclusion, cerebral malaria constituted a substantial proportion of adult plasmodium falciparum malaria admissions at the Muhimbili National Hospital, as I said, with a percent 47.8%. Despite frequent neurological and systemic complications, most patients recovered and in-hospital mortality was low. Continued emphasis on early recognition, prompt parental therapy, and systemic monitoring for complications, especially for cerebral edema and renal impairment, may further improve the outcome. The study also recommends that the availability and timely administration of intravenous artesunate, which contributed substantially to the favorable outcomes observed. Thank you very much.
Thank you.